change in bowel habits, frequent abdominal or pelvic pain, weight loss without known reason, blood in stool. Did you know these are symptoms of colorectal cancer? My name is Doctor.Global. Let's discuss this disease in more detail. What is colorectal cancer? Disease types and epidemiology. Colorectal or colon cancer is a malignant tumor of the colon and rectum, in which cells are first dividing on site and then spreading in different tissues out of the intestine. The variety of abnormal cells defines the colorectal cancer type. The most common, 95%, are adenocarcinomas, which arise from glandular epithelial cells. Typical adenocarcinoma takes at least 10 years to develop from benign adenoma. Is CRC fatal? The 5-year survival rate for colorectal cancer, CRC, shows that 90% of people with localized, 70% with advanced CRC, and 10% with metastatic CRC are alive 5 years after diagnosis. Is CRC preventable? Yes. Regular screening and removing polyps at an early stage is crucial. It helps to detect abnormal cells before they turn into cancer. Causes and risk factors. The most common scenario for colorectal cancer development is when epithelial cells undergo a series of genetic or epigenetic changes that enable them to be hyperproliferative, to grow fast and spread far. The cancer begins with a tiny benign adenoma in the colorectal segment of the intestine. Over the next 10 to 15 years, chronic inflammation can lead to cellular damage and adenomas through microsatellite instability in 20% of cases, or chromosomal instability in 80% of cases. There are two groups of risk factors for the development of colorectal cancer: non-modifiable and modifiable. While modifiable risk factors are linked to specific habits or lifestyles, the first group is uncontrollable by individuals. Non-modifiable. Age. Most colorectal malignancies manifest at over 50 years. Gender. Males tend to be more likely to develop CRC. Ethnicity. Black men and women have the highest incidence and mortality rates among races. Medical comorbidities. For example, inflammatory bowel disease in medical history triples the chance of developing CRC. With type 2 diabetes mellitus, the CRC risk is shown to be approximately 5 times greater than in people with no DMT2. Family history of first-degree relatives with colorectal cancer is associated with 2 times higher risk. Modifiable. Physical inactivity, obesity, regular alcohol consumption, cigarette smoking. Eating more than 500 grams per week of processed and red, beef, pork, lamb meat raises colorectal cancer risk by 20 to 30% due to the carcinogenic effects of heme iron molecules. Lack of high-fiber dietary patterns such as vegetables, fruits, whole grains, and cereals. Symptoms. Initial symptoms of CRC are change in bowel habits, such as diarrhea, irregular bowel movements, and a feeling of incomplete bowel emptying, blood in stool, frequent abdominal or pelvic pain, aches or cramps, weight loss without known reason. Screening. Regular CRC screening begins at 45 years old in the US and 50 in Europe. Screening tests can detect asymptomatic precancerous polyps so that they can be removed before turning into cancer. CRC screening methods include a occult blood test or the fecal immunochemical test every 2 years to identify if there is silent bleeding from a damaged intestinal polyp, flexible sigmoidoscopy or colonoscopy every 10 years. Diagnosis. The diagnostic process is crucial for both patients and doctors. It helps determine the stage of the cancer, make treatment choices, and monitor the effectiveness of treatment. Diagnosis includes clinical examination, palpation of the abdomen and rectal examination, endoscopy. Doctor inspects the interior of the bowel for abnormal areas or growths in the inner lining of the intestine. Histopathological examination means laboratory investigation of the tumor tissue obtained via endoscopy under a microscope. CT scans, MRI, and positron emission tomography can determine the level of tumor spread and the presence of metastases. Laboratory tests. Routine blood sample measurements give information on complete blood count and liver-kidney function. Treatment. Treatment options depend on several factors, including the type and stage of cancer, patient's overall health, and possible side effects. Stage 0 colorectal cancer. The Stage 0 colorectal tumors have not grown beyond the inner lining of the colon. Minimally invasive surgeries that remove the cancer by cutting out the polyp can be the only treatments needed. Endoscopic mucosal resection or transanal minimally invasive surgery are highly effective and safe procedures. Stage 1. More advanced surgical methods may be used when the cancer penetrates deeper into the intestinal wall, but does not spread beyond the colon or to nearby lymph nodes. Minimally invasive surgeries, if the removed tissue has clear margins. Further treatment may not be necessary. Partial colectomy is a standard treatment for advanced CRC stage 1 when polypectomy is ineffective or insufficient. The surgeon takes out the part of the colon with the cancer and a small segment of the normal colon. Colectomy can be performed by traditional open surgery or by minimally invasive laparoscopic surgery. Colorectal cancer is treated in hundreds of clinics worldwide using various approaches and equipment. However, not everyone knows that the cost of treatment in different countries can vary widely, even with the same high level of quality. For example, procedures such as Hartmann's operation, proctalectomy, or total colectomy can cost twice as much in Australia and Spain as in Brazil, Czech Republic, India, and Mexico, but half as much in Germany, South Korea, and UK. In order to find the appropriate treatment conditions in advanced clinics around the world, we created the Doctor.Global service. The platform is designed to help people get a second or third opinion, choose the best clinic location, or find the right cost and treatment date. We act as an involved mediator, helping to obtain comprehensive information from clinics, translating and organizing the patient's medical records in any language, and enabling the patient to make a meaningful choice of clinic or doctor. Follow the QR code link, click Your Request at the bottom of the screen, and describe your case. We will contact you back for confirmation and immediately start searching for treatment options, considering all your wishes. Nothing is more valuable and important to us than your health. Now, back to the treatment. Stage 2 and 3. At Stage 2 and 3, the cancer penetrates the intestinal wall and may invade nearby tissue. By Stage 3, it also reaches nearby lymph nodes. Partial or total colectomy at Stage 2 involves the more advanced removal of the colon along with nearby lymph nodes. Chemotherapy uses anti-cancer drugs to destroy cancer cells. Chemotherapy is sometimes given before, after, or during the surgery. Hyperthermic intraperitoneal chemotherapy or pressurized intraperitoneal aerosolized chemotherapy. Radiation therapy may accompany the surgery when some advanced Stage 3 tumors are found to be spread to a nearby organ. It can be done before, during intraoperative radiation therapy, or after surgical treatment. Radiation therapy may be given as external radiation therapy, which helps to focus the radiation beam on the cancer from a machine outside the body. Internal radiation therapy, or brachytherapy, treats rectal cancer since the radiation source is put inside the rectum next to or into the tumor. Stage 4. The issue with Stage 4 is that it's a metastatic cancer affecting the liver, lungs, and bones, making surgery palliative, aimed at comfort rather than cure. At CRC Stage 4 radiation therapy, chemotherapy and immunotherapy are the first-line treatments. Immunotherapy is a type of treatment that uses a person's own immune system to help destroy cancer cells. The medications block the ability of cells to produce growth factors, thus shrinking the tumor. Follow-up care. Patients usually undergo follow-up screenings every 3 to 6 months for the first 5 years after the diagnosis. These screenings may include CT, MRI, carcinoembryonic antigen CEA test. Hope you have learned something useful today. Do not forget to like this video and share with your friends. We sincerely wish good health and success to you all.